Hello everyone. Today we are going to talk about risk factors, its types, and how to assess risk
और रही
factors.
बात उन 6 या 5 मरने वालों की, माय डीपेस्ट सिंपैथीज क्या करें। लेकिन अगर आप फुटपाथ पे सोएंगे तो मरने का रिस्क तो रहेगा ही।
What is risk? Risk is all around us. If someone is driving crazily, we are at risk of road traffic accidents. If someone sneezes beside us, we may get flu. Obesity boosts the odds you will get diabetes. Smoking increases your risk for many cancers. And if you are paying attention to news headlines, you may at risk of food poisoning, diarrhea, waterborne other diseases, viral infections, and whatnot. How can you know which health risk apply to you? As far as the infectious disease is concerned, there are so many things which can be predicted. For example, age, gender or occupation, and which kind of viral or bacterial infections as per the symptoms and the signs. But when we talk about the risk factors in the context of non-communicable disease like diabetes, hypertension or many cancers, it may be very difficult to decide which risk or which etiology might has lead to the particular disease. How? While age, our gender, our occupation, where we live, what is the location, what is the area, that is urban or it is slum. So those kind of things also known as determinants of the disease. While determinants is a very crude or vague term, but suppose we want to assess how much risk factors causally associated, then it can be quantified in terms of the risk factors. Then what is the definition of risk? To prevent the health problem before it happens, you need to know the risk factors which can predict the problems. If father is asking his son to buy packets of gutkha or bidis or cigarette, then there is more likely that the kid will also start using it very soon. Like in Mumbai slums, 1 in every 6 child of 14 to 17 years uses tobacco products. So risk can be defined as a risk factor is a characteristic, condition or behavior that increases the likelihood of getting a disease or injury. There are other terminology or terms used as synonyms that might confuse you with the risk. That is chance, probability, luck, incidence used to measure risk, hazard, uncertainty. Chance or probability is a broad term which is used in terms of statistics. Means what is the probability or chance of developing a particular condition. Luck most of the time used in the positive sense, that what is the chance of winning the lottery or what is the chance of winning a match, like that. Incidence also measures the probability of getting disease, but incidence is used to measure a risk. Hazard is used as measure of risk. Sometimes we also call it measurement of hazard ratio. Uncertainty is like a probability, so the probability interval or confidence interval also sometimes used as an uncertainty interval. What is the difference between risk and vulnerability? What do you think? Everyone driving a bike on the road is at risk of road traffic accident, but those who don't wear helmets are more vulnerable to severe head injury, isn't it? Risk versus vulnerability. More examples. Violence and abuse. Poor and underprivileged groups living at the area like urban slums are at more risk of violence and abuse. But the women and children of that groups are more vulnerable than the rest of the people. Sexually transmitted disease. The people having multiple sexual partners, we say that they are at high risk of sexually transmitted disease. The person or the people not using a personal protection are more vulnerable to develop sexually transmitted diseases. What is the use of mapping out risk factors or vulnerability? Knowing risk and vulnerability. How would it help? It is important that we understand the causes and risk factors behind the diseases so that we can actively take part in available cost-effective prevention and treatment programs. For example, we know that many children in our country die because of the severe dehydration due to diarrhea. By implementing or by use of simple oral rehydration solutions could save many lives, isn't it? Risk factors also can be categorized into various categories. For example, behavioral risk, physiological risk, demographic risk factors, environmental risk factors, and genetic risk factors. It can be divided into modifiable and non-modifiable risk factors based upon whether they can be changed, modified later or not, or it cannot be modified or changed later on, respectively. For example, modifiable risk factors are our weight, our sedentary lifestyle, what we eat. Non-modifiable risk factors are our age, our genetics, our family history, our height, and our build-up. Behavioral risk factors, which are the example of behavioral risk factors. Smoking tobacco, drinking too much alcohol, nutritional choices, what we eat, high calorie intake, food, eating sugars, and so physical inactivity, also known as sedentary lifestyle, spending too much time in the sun without proper protection, not having certain vaccinations, unprotected sex. These are the example of behavioral risk factors. Physiological risk factors, which are the example: being overweight or obese, high blood pressure, high blood cholesterol, high blood sugar. These are the example of physiological risk factors. Demographic risk factors: age, gender, population subgroups such as occupation, religion, or income. Age and gender is an example of non-modifiable risk factors. Environmental risk factors: access to clean water and sanitation, risk in the workplace, air pollution, social settings. Genetic risk factors, which are the example: many other diseases such as asthma, diabetes reflect the interaction between genes of the individual and environmental factors. Breast cancer, many other blood disorders are related with the strong positive family history. Global risk for mortality and demographic factors. The 10 most common risk factors that caused a large portion of total global deaths were studied in 2004, and it is found that out of so many other risk factors, there are 10 most common risk factors that are responsible for the majority of the deaths, among which top 5 were high blood pressure, tobacco use, high blood glucose, physical inactivity, overweight and obesity were responsible for the majority of deaths from the cardiac disease, heart failure, stroke, cancer, and diabetes. Common risk factors for non-communicable disease. Did you know that a person's age, lifestyle, environment, genetic makeup, and family history can increase the likelihood of developing lifestyle disease? Over 61% of all deaths in India attributed to lifestyle or non-communicable disease like diabetes, cancer, hypertension, cardiac disease, and so. More than 1.73 million new cancer cases likely to be recorded each year. Air pollution, tobacco, alcohol, and diet change are primary triggers. Advancing age is the most important risk factor for development of cancers. The median age at diagnosis for all cancer combined is 66 years. The incidence rate in India began to rise at 30 years and it is continuously increases after the age of 55, and the most common cancers are after the age of 55. Every 12th Indian are diabetic. India ranks second in the list of countries with highest diabetes patient. Majority risk factors are related to person's lifestyle or overall health. Obesity kills more than smoking. About 8 out of 10 people with type 2 diabetes are overweight or having obesity. If you are at risk for type 2 diabetes, losing 5 to 7% of your body weight and getting regular physical activity may prevent or delay the onset of type 2 diabetes. Losing 5 to 10% of your weight may lower your risk factors for developing heart disease by improving blood pressure, cholesterol levels, and blood flow. Obesity also increases the risk of breast, colorectal, and other type of cancers. Some substances known as carcinogens can damage our DNA and cause cancer. One of the most common example of is tobacco, a proven cause of cancer. Tobacco is not only responsible for lung cancer, but it is responsible for many other types of cancer, almost around 16 types. A person can be exposed to tobacco by smoking or chewing tobacco, and possibly by inhaling tobacco smoke from someone smoking nearby, known as passive smoking or second-hand smoke. A major risk factor for non-communicable disease, tobacco use causes the death of over 8 million people per year around the world. In India, tobacco-related cancers accounted for 27% of country's cancer burden in 2020, according to Indian Council of Medical Research. Tobacco is the most notoriously associated with lung cancer, but it also leads to diabetes, heart disease, stroke, and many other cancers. Common risk factors: alcohol. Drinking alcohol increases the risk of developing high blood pressure, heart disease, stroke, liver disease. Alcohol also causes cancer of mouth, throat, esophagus, larynx, liver, colon, and breast cancer. The more a person drinks, the more likely they are to develop cancer. The risk is even higher for those who drink alcohol and also use tobacco. When combined, alcohol and tobacco use increases the health risk to many folds. Environmental toxins. Around 20% of cancer cases are due to toxin present in our environment. Individuals may be unknowingly exposed to those agents if they work in certain mining, agricultural, manufacturing, welding, printing, or painting industries in which they are exposed to substances such as arsenic, asbestos, volatile organic compounds like benzenes, etc. Exposure to these substances may lead to heart disease, and lung and bladder cancers and leukemia. Genetics. Your chances of having heart disease is high if your first degree relative have had heart disease in the past. Same is also true for stroke. Genetic predisposition is an important non-modifiable risk factor. It's important to be aware of it even if we can't prevent it. In breast and ovarian cancers, certain mutations in BRCA1 and BRCA2 genes are well-known risk factors.